so I can share it with everyone. How many of you are taking the exam tomorrow? Nobody? Okay, all right. How many of you are snowed in?
Me.
Where do you live, Tara?
I'm in Wilmington, Ohio, so just a little bit above Cincinnati. We got about
Yeah,
12
I know where
inches.
it is. Yeah.
Yeah.
Okay. Yep. My 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 family is snowed in too, and they're in north of Dayton. So
Okay. Yeah.
okay, so let's play Jeopardy, and so anybody can choose any category and any value. Okay, so just start picking one, and we'll go through all of them. If you know how to play Jeopardy, you come up with a question. I click on it, and it'll give you an answer. You come up with the question. Okay. Go ahead. Somebody go. Brooklyn, your face is on the screen. I love it. You want to pick a question? Everybody can answer it. Just because you
I
pick a
was,
question doesn't mean you have to answer it.
I would say defining pregnancy for 300.
Okay. Amenorrhea, nausea and vomiting, and fatigue.
Is that a presumptive sign?
Okay. Presumptive signs of pregnancy. Exactly. Remember, the signs for presumptive are not measurable. They're things that the patient is experiencing. Okay.
If it helps anyone, our professor told us the S in presumptive, think of it as like subjective data.
Subjective. Exactly. Okay.
Let's
I don't know why
do,
that's. Wait a minute. I think I. There we go. Go ahead. I'm sorry.
oh, what about screening and testing for 400?
All right.
What is Rogram?
Yes. What is ROGAM or immu, immunoglobulin? I couldn't get it
I
out.
can never say that word.
Immunoglobulin. D. All right.
I'll take embryology and fetal development for 200.
All right. The location
At,
of the fundus at the 20th week.
at
The
the umbilicus.
umbilical.
Yeah. Yeah. Umbilicus, right there in the middle, halfway through the pregnancy, it should be reaching. Remember, the fundus is that strong uterine muscle on top.
Maternal and fetal nutrition for 100.
The
What
underweight.
is unhealthy or underweight?
Yeah, they're probably unhealthy too if they're underweight, right? Maybe, not necessarily. Yeah. What is an ideal weight? BMI.
23. No.
23 is well. What's the range? I should ask. What's the range?
Over 18.5 and up to 25.
24.99. Yeah. Close. Okay. What's
Let's
next?
do danger signs for 200.
Okay.
I'm not sure about this question.
Like counting the fetal count in the hour.
Okay.
Fetal kick counts.
Okay.
Yeah. So we teach our patients about fetal kick count every day, especially if they're high risk. In that last trimester, they need to be aware of how much their baby's moving, because if there's a change, then we need to know. So 10 times in 2 hours. So they need to stop what they're doing and count unless they know that the baby's moving a lot during the day. But it's those change in those movement. If they're used to, if their baby moves a lot, in the evening hours, and then they notice a change, they're in a different pattern. Maybe they're not moving as much, or maybe they're moving at a different time and not as much. So we need to know those kinds of pattern changes.
You said 10 in 2 hours is considered
10 movements in 2 hours. Yeah.
Okay.
Fetal kick counts.
Defining pregnancy 500.
True.
Wouldn't they be a
And
multi
multi-gravida.
gravida?
She's a multigravida and a multipara, right? Do you remember what the multipara is?
Delivered over 20 weeks.
So she delivered 2 children over 20 weeks. Okay.
What about vulnerable and high risk populations for 400?
Single family, single family, single parent,
Yeah.
single parent.
Yeah, the single parent.
Screening and testing for 100. Is that the stress test?
Yeah, the non-stress test. Yeah, we want
Non-stress
we want to see the baby's heart rate go up when the baby moves. Okay. Okay.
Vulnerable and high risk populations for 300.
Is it what? That's not a nuclear family.
Yeah, it is.
Oh, it is.
Nuclear
Okay.
family. They're not vulnerable though, are they? Unless there's that mom's got a disease or sick.
Right.
Defining pregnancy 300 or 400.
She's a multi-gravida, and is she multi-part? No.
Is this asking for like the full GPTAL?
Yeah, I think so.
Yeah,
I
I
think
was
it's
wondering that too.
I think it's G3. Um, P P2
P2?
or 3. Yeah, 37 weeks is throwing me off.
The 37 should be
It
37.
should be okay,
Full
right?
term. Mhm.
Okay. So G3, P2,
Would it be
and then
great?
A1 because of the stillborn.
And
So how
living
many times has she conceived?
3. Right?
4?
Four
Four.
times. So the G would be
4
4.
times, right?
Okay. How many full-term babies?
One.
Just a 37 week. Okay. And then how many preterm deliveries?
3.
Two.
3.
Three. Okay.
No abortions. But
I
she
thought the
has
stillborn would fall under that.
no.
Okay.
Stillborn doesn't fall under abortion because it was delivered at 27 weeks.
It's before 20
Preterm.
weeks.
It goes with the preterm babies.
Okay.
Okay. And so how many living children does she have?
Is it three?
Well, she a set of twins,
4.
2, 3, 4.
Four. Okay.
Tells you at the beginning that she has 4 children.
Okay.
But it's always good to double check. Yeah, that was a little more complicated. Okay. Does everybody, that make sense? So that would be a G4, T1, P3, A0, and living would be 4.
So it's only an abortion if it's under the 20 weeks.
Mm-hmm. Yep.
Physiological changes for 500.
So this is talking about the cascade, clotting cascade during pregnancy. It changes. So if you have increased fibrinogen in your system, you're making a lot of fibrin, which are clots, right? And you don't have as much fibrinolytic. In other words, the 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 products or the factors that help break down the fibrin.
Increased risk for a DVT or a PE.
Yep. Yep.
Good job. That one was hard.
That one is hard. And you know, if you're
Agreed.
not as familiar with the bleeding cascade and the clots and stuff, it's a little more difficult. Okay.
Danger signs for 100. Is that IUGR?
Placental
Oh,
abruption.
okay.
Vaginal
The
bleeding.
bleeding. Okay.
Vaginal bleeding. Yeah, it's a danger sign. Anytime during pregnancy, if a woman says she's bleeding, that's something she needs to let her provider know. Does that make sense? She
Okay.
shouldn't be bleeding.
Okay.
Something's not right.
Maternal and fetal nutrition 500.
IUGR. No.
So that's what it's talking about. It's talking about IUGR. Tobacco use, nicotine. Nicotine reduces the quality and the quantity of oxygen in the blood, and so do other substances. But it is IUGR. Mm-hmm. Intrauterine growth restriction.
Maternal and fetal nutrition for 200.
Majority of calories should be consumed from which food group?
Fruits and vegetables.
Now we're thinking pregnancy. Okay. Believe it or not, it's a little different.
Is it
Oh,
Is it
carbs.
protein?
Carbohydrates.
Yeah.
Complex carbohydrates.
Complex carbohydrates. Yes. Because there's a lot of vitamins in those and protein. So rice, beans, potatoes, corn, those things, all kinds of beans.
Screening and testing for 500.
Is this the contraction test, stress test, or something like that?
Yeah, it's
Yeah.
the oxytocin contraction test, stress test. So it's the opposite of the non-stress in that we want a negative result. We don't want to see decelerations.
And nipple stimulation can be used for this
Nipple
too, right?
stimulation, same thing. Yeah, you can do that too. Nipple stimulation actually releases oxytocin from the posterior pituitary.
Screening and testing for 200.
Is it folic acid?
No, it's
No.
is it the MSFAP?
Oh.
Mm-hmm.
Okay, I can't remember.
It's a protein,
It's a protein. Okay.
alpha-fetoprotein. Yeah.
It's a
So
protein.
it is. It's a maternal serum alpha-fetoprotein.
Danger signs for 500.
Preeclampsia? A sign of preeclampsia?
Yeah, and anytime that your patient is complaining about a headache, you need to follow up with it if it doesn't go away. So that's just a few signs of preeclampsia, which you're not really learning about yet, but you need to have an idea of what kinds of things that require the patient to call the office.
Danger signs for 300.
Okay.
Braxton Hicks?
Braxton Hicks are usually on the side.
Lordatus
I'm sorry?
is like LORDA.
Lordosis,
Yeah.
along with pelvic pressure.
Oh, yeah. Okay.
Those are dangerous signs because it could be early labor,
Yeah.
preterm labor. So this would be after 20 weeks. After 20 weeks, if she's experiencing low back pain, pelvic pressure, that sort of thing, we're concerned about preterm labor. If she's, before 37 weeks, it would be preterm signs.
Physiological changes for 200.
Okay.
Pregnancy. Oh,
What did you say?
Cardiac output.
Uh-huh. Uh-huh. Cardiac output.
Maternal and fetal nutrition, 300.
Should be avoided during pregnancy.
Yeah. Mom may be able to tolerate food poisoning and that sort of thing, but a fetus can't. Okay. We need to make sure all meats, and sometimes you can buy deli meat that's not completely cooked. And if she buys deli meat, she needs to microwave it and make sure it's completely cooked. I think you can get listeria that way. Everything needs to be pasteurized for a pregnant woman.
Defining pregnancy, 200. Was there positive signs? I mean,
Probably.
probable, yeah.
Probable signs, yeah, probable. These are the clinical signs. These are the things that you as a nurse are observing. It's
Right.
not positive, but it's a good indication.
Danger signs for 400.
Flank pain?
Yes, flank pain. So pyelonephritis is kidney infection, right?
Defining pregnancy, 100?
You know, when you have muscle pain, sometimes it helps to stretch it a little bit, warm it up and stretch it, the muscle.
Is it yoga?
Muscle,
Effleurage.
Oh, effleurage, yeah.
actually, it's pelvic rock.
Yeah.
Your book doesn't talk about this, but it's like laying on your back and bringing your knees up to your chest and rocking. It rounds the back out the opposite direction, and that stretches those back muscles. If you ever have back problems, you'll learn how to do. Another thing you can do is actually rocking the pelvis forward on the hands and knees on the floor. Let the belly fall way down and then bring it up like a Halloween cat. That's another pelvic rock.
Is it almost like doing the yoga pose, the cry baby pose? You rock from side to side like that? That's the pelvic rock?
Cat
I'm
cow.
not sure. I've never done yoga.
Oh, okay, okay. I was just trying to get an image. Would you say, Tara?
I think it's cat cow pose in yoga. I'm not
Gotcha.
sure.
Okay.
Okay.
Screening and testing, 300.
Gene testing?
Genetic screening. Yeah, gene testing. That's exactly what it is. We call it screening. So we're looking for abnormal genes. So remember, cystic fibrosis and sickle cell are autosomal recessive. And it requires both parents to have the gene.
Really quick, what does the amniocentesis, what can that test for again? Just the baby?
Amniocentesis gives us a lot of information, the amniotic fluid, but it's the AFP that you need to know. The AFP can be found in mom's blood. It can be found again in the amniotic fluid. And if we find it in the amniotic fluid, it's a more specific and sensitive. So it's more indicative. It's a little stronger indication. And we usually follow that if that's what mom wants to do.
Okay.
What's next?
I think maternal and fetal nutrition for 400.
How does oxygen get in the blood?
By the vein.
Get in fetal blood. It's diffused, right? It just goes across the cell on its own. But the nutrients have to be actively transported across. The reason I mention that, because you might not remember in microbiology how things pass through cells. Some things require energy to get to the other side. But all the gases, they just diffuse across. They just go right through the membrane. Whereas nutrition and other substances that are more solid require energy. But the placenta or the fetus receives nutrition with active transport. I don't know if you really need to know that, but just in case.
Physiological changes for 400.
Now, this is the lordosis that someone mentioned earlier, because the back sways, goes inwards because of the large belly and the baby and the amniotic fluid. Her center of gravity shifts. So she's almost waddling as she walks. The pelvic structure is put together and held together by ligaments, very strong ligaments, the hips and the back. And so during pregnancy, progesterone and relaxin, there are two hormones, make those ligaments softer, more fluid, so that her pelvis can accommodate a fetus and can change during labor. I don't know if I gave you the answer or not. Okay, I did. I know I didn't talk about it in my class. I don't know if anybody else did. But progesterone in particular will cause some musculoskeletal changes. And she can have low back pain because of that shift in gravity.
Vulnerable and high risk populations for 500.
The cultural competent.
Well, she certainly would be culturally competent if she met standards.
Standard of care.
What's a standard of care? Yes.
Vulnerable and high risk population for 100.
Adolescence.
Adolescence, yes.
Vulnerable and high risk population for 200. Is it African American women?
Or the more popular way of saying it, women of color, right?
Yes.
Yes, I should change that. Okay.
Embryology and fetal development for 500.
Folic acid.
Yep. It's the growth vitamin. Our cells can't grow without folic acid.
Physiological changes for 100.
What happens when the plasma volume increases?
Anemia.
Physiological anemia or dilutional anemia. Yeah. Good.
Physiological changes 300. Estrogen.
Estrogen.
Estrogen. Good. Yes.
Let's do 100.
The first
The
8
first
weeks.
trimester.
First trimester, third weeks 3 through 8. That is the embryonic period.
$300.
400. So when does fetal life begin? What week?
Time
Is
of
this the 7th or 8th week?
Mhm.
is it time of conception?
It's what?
Week 20. Mm.
Nobody has said
Or is it at birth? I don't know. Oh,
Okay.
the 9th week.
9th week. Okay. We was trying to get it.
Fetal life. Yeah, embryology is weeks 3 through 8. Prior to that, it's a blastocyst or a zygote. Then at week 9, it's a fetus until it's delivered. All right, one more.
Down syndrome.
This is Down syndrome, yeah. All right, I have another one. Intrapartum, this one isn't as long. You can see there's 3 categories. Labor, ouch, and reassuring and non-reassuring.
Ouch for 200.
is it new bean?
It's asking, read it again.
Is it respiratory depression?
Yeah. It's not asking for, it's not trying to get you to say a drug. But Nubane could do that, yes.
Ouch for 100.
Amniocentesis. Or like C-section.
So it would be a C-section. This has to do with ouch, right? Pain management.
Where they turn the baby. I'm not, it's like an extra version, I can't remember the name of it.
But we're talking about labor and delivery.
Labor and delivery.
So
Is that like
external version. You're talking about version?
Yeah.
Yeah. The nurse would be there, yes. But we're talking about labor and
Is it the
delivery.
epidural?
Yes. Epidural. Why? Why are we concerned about an epidural?
Is it hypotension?
Hypotension.
Hypotension, yeah.
Labor for 400.
I should be in the last column. Got it in the wrong column.
She's in labor.
Mhm.
Is that too many contractions in that interval?
Okay, so it's
Yeah.
called uterine
I could not think
tachycardia.
of that word.
Me either.
Instead of tachycardia, it's tachysystole. It is a contraction, just like systolic systole of the heart is a contracted heart, right? So it's the uterine tachysystole.
Labor for 100.
Contractions that are close together.
No, we don't want them too close together. There's two things we have to see, or have to be occurring, I should say.
The cervix thinning.
Okay, that's one.
Rupture of membranes.
No.
No.
Dilation.
The
If
effacement.
cervical changes is one. What's the other one?
Effacement that has to do with cervix too.
Well, yeah, that's what I mean by cervical changes.
You want
Effacement,
steady
dilation,
contractions, like regular contractions? Is that what you're
regular
looking for?
contractions. Okay. Remember that the job of contractions is to dilate and efface the cervix. And of course, help the baby descend. Okay, but that's why we need contractions, so we can dilate and thin the cervix.
Reassuring and non-reassuring for 100.
Is it variability?
What is variability? Yep.
Out for 400.
Massages.
Yeah, touch. Yeah.
Okay. Back massage, acupuncture, acupressure, intradermal water block, warm shower.
Labor 500.
Is it doing the second stage?
Yeah. Wait, no, it's the third stage, I believe.
Third stage. Okay.
Yep, third stage.
Ouch for 300.
An epidural? Or a spinal cord?
During is it the first stage?
Oh, stage. Second.
Second is
Mm-hmm. So the pudendal nerve is one of the
That's for the
spinal nerve.
peri area, correct? Okay.
It's the peri area. Yeah, it's the vulva, the very superficial area to repair an episiotomy or a tear, or any kind of. Sometimes they use it for other kinds of surgeries. Okay.
Labor for 300.
Is it crown the? Is it crown the? Crown the rump? Oh,
What were you saying,
is it
Gwinnett?
crown to rump or
Crowning,
crowning? Okay.
vulvar crowning. When everything's stretched out, the vaginal tissue is all stretched out, and you can see the head. And the vulva is covering the head, except for a little area. It's crowning. It's a bulging of the perineum, you could also say.
Reassuring, non-reassuring, 300.
A decel?
Deceleration. What kind of a deceleration?
Early deceleration.
Late?
A late, yeah. Late because the contraction is going away. So what would you do? What's the nursing responsibility if she observes late decels? What would you do?
No
Notify the
inter-
The patient.
Oh yeah,
How?
you can tell me. Yeah, you can.
And
I left side.
To the left side, yeah. Get her off her vena cava if she's on her back.
Ouch for
Later,
500.
oh,
Oh, sorry. Go ahead.
go ahead.
This one's a little tougher because it's kind of abstract.
Is it placental abruption? I
Does
mean,
this have something to do with position?
No, it is one of the P's.
preview. No, I don't know.
Is it power? Not power.
The
Position,
five P's, I should say, the 5 P's of labor progress. It's one of the 5 P's.
position, power, psych, passageway.
Psychological reasoning? No.
Anybody?
The one with the baby, the very first one.
Primary power? No.
Anxiety.
Anxiety.
The psyche, yeah. If we have a woman that is anxious, that tends to cause her uterus to become the contractions to not be very effective, and she's going to have more pain. Okay. So that would be the psyche, the P in psyche.
Labor for 200.
So this is another one of the 5 P's.
Passageway.
Passageway. Yeah. Okay.
Let's do 200. Acceleration.
Oh, sorry.
Variability.
Variability. Yeah,
Okay.
variability.
The first position to turn them if she's experiencing the supine hypotension.
Okay, supine hypotension. So this position enhances the largest amount of blood flow to the uterus and hence to the fetus. So if she's experiencing hypotension, we want to make sure baby has adequate blood flow, right? Oxygenated blood. And then, of course, for late decelerations, we want to improve uterine perfusion. So we're going to reposition her. What do we call the mnemonic?
Veal chop mine.
Veal chop mine. Yeah. Good. All right. That's all I have then.
Thank you. I think this is really helpful. Got me thinking.
Oh, good, good. I'll post the recording when it's ready, okay? But there should be a link. I'll put the link in the chat. You can go directly to the game and just practice it yourself. You don't have to watch the recording again. Okay, I'll put it in the chat so you can copy and paste that.
Thank you. Appreciate it.
You're
Thank you so
welcome.
much.
Thank
You're
you.
welcome. Good luck on your
Thank
exam.
you.
Thank you.
You're welcome. Thank you.